Well, welcome to class, everybody. It is my pleasure to be your instructor today. So my name is Eunice. I'm a registered nurse, and I'm also an American Heart Association Training Center faculty member. So big term for something that simply means I get to train new instructors. So I get to train the public, but I get to also train and mentor you. So welcome to the American Heart Association Basic Life Support, BLS, which is pretty much team CPR. So it teaches individual CPR, but it teaches you to work together. Agenda today, what I like to say is when it's done, it's done. Mm-hmm. So we try to get everything done. The first half of the class is skill and book heavy. You have your first test, which is the provider exam. It's the same exam that you'd be giving to a student. Mm-hmm. So whenever the American Heart says provider, just think student. And then after we learn everything, we take a quick break, get something to eat. That's when we'll come back and we'll do our instructor exam. Okay. Do you all remember what a passing score is on the provider exam for an instructor?
Is that 80?
90.
90. It's 90. If you're an instructor taking the exam the students would take, passing is a 90. But for the instructor exam, passing is 84. So great. Restrooms, you always want to talk about safety. So our restroom is not in our actual unit, it's out in the common area. So when we take our first break, I'll show you where the restrooms are. Does anyone need to go to the restroom right now? We're probably going to be talking for about an hour doing skills for our first hour of the class. And we always do a review before we start, because if you don't use it, you lose it. We want to make sure that everybody's on the same level before we actually get to the deeper parts of the class. We have a nourishment room behind you. We have coffee, we have water. The smaller bottle of waters are flavored water, so if you don't like flavoring your water, just get the big bottle. And we also have popcorn and some breakfast bars. So any questions about that?
Nice, thank you.
You're very welcome. We want to make sure we feed you all because you all travel a lot and travel from distances. So let's start with our review. For our first part of the class, you have a piece of paper on your tables. Can I have your roster, please?
I checked the schedule for tomorrow. It looks good.
Perfect. So you'll be monitored
to the
tomorrow.
calendar later at lunch.
2 days without you at work. Are they going to survive?
They can survive. They have to. They have to.
All right. And so let's just do. I told you about myself. Verona, would you start? Would you please introduce yourself to the group? Tell them the reason you're taking the course, and maybe and of course your profession and a fun fact.
My name is Verona. I did unassisted living for many years, over 14, 15 years, and I used to teach Red Cross. And so my thing lapsed. And so when my daughter kept saying, why don't you go back and do it? And I'm like, okay, I will. Went to Jamaica after COVID for almost a year. And I was searched to do my CPR and American Heart. And I said, you know what? I think if people have it this difficult to find a place, I'm going to start. I also do medical missionary work where I go out and teach persons how to take care of themselves, change their diet when they have blood pressure, diabetes, because those are food causing that.
Very important.
Healthy lifestyle, pretty much. So I want to incorporate.
So you're teaching health and safety.
Yes.
All right. So now tell me a fun fact.
Fun. What do I do for fun?
Aren't you about to go on vacation again?
I'm going on vacation to Jamaica.
Yeah, that's gonna be beautiful. And did you see how she just swung her hair? Where are you going?
Jamaica.
Oh,
so
nice.
Yeah, so she actually scheduled this whole visit is wrapped around her visit to Jamaica. I was like, are you
going to leave from Florida?
And just go straight to Jamaica.
So you just coming right on?
Yeah.
And so she plans very well. So thank you for introducing yourself, Verona. Tracy, would you please introduce yourself to the group?
Yes, Tracy Gibbs. I work for Rainier. It's a timber company, so I take a lot of this training and keep not only our employees safe, but loggers. People do not want to go in the woods. They don't want to teach people with a big wad of tobacco, just things like that you have to deal with, and they are just neglected. And so we help them. and in our company. And a fun fact, I guess it's fun. I don't really know. I like to golf.
That is
I like to
fun.
golf. I have 4 children and 3 dogs. That's funny. So, there's about 6,000 contractors, so I had to get some help, like in Washington and other states and stuff. So I just haven't done it. But my dad, not a fun fact, but a fact, that he died from a heart attack at work.
Very sorry to hear that.
With the gentleman that did not know how to do CPR, and he feels bad, and I feel bad, and so, but we both ain't gonna live in guilt because everybody's got a time, and the Lord's got it under control. So,
And you're doing what you can do. So that is a wonderful why, making sure that you're teaching others, especially workplaces, even though you can't be everywhere. So if you ever need help, I travel, I'll go with you. All right, so Darren, would you please introduce yourself to the group?
Darren Ross, I'm a safety coordinator for Pella Windows. We build all the hurricane type windows and such. So we have 70 people on staff that I'm responsible for making sure that they follow procedures and go through the safety training. And this is one of the things I do for, we actually have a small responder group that we have set up. So I'll be recertifying them.
I love it. Fun fact.
Fun fact, paramedic for 30 years.
That's crazy. The stories he could tell, right?
That's awesome.
you got this.
You got it. All right. So he's also renewing his certification. And so welcome to class, everybody. We're going to get started with our review. So the papers that are on your tables, American Heart Association allows open resources. So if your students take notes, if they bring their books, they're allowed to utilize them during their test. What I like for my instructors is I need to know that you're smarter than a student. So we're going to do this review. You can take your notes, but when you take your first test, I'm not going to allow you to use your notes initially. I want to see how well you can do because your students may be asking higher level questions. So I need you to be confident in being able to answer the questions without always going to your resources. Right. So first, it's not on here. What does CPR stand for?
Cardiopulmonary
Resuscitation. All right, so write it down. Tracy, you did not answer.
Oh, I'm sorry.
CPR, what does it stand for, everybody?
Culinary. Okay.
So cardiopulmonary resuscitation. So what organs in the body are we trying to sustain? Cardio, what organ? Heart. Pulmonary, what organs? Lungs. Resuscitation. Chest compressions and rescue breaths. So when you're teaching your classes, you're focusing on high quality CPR, which includes chest compressions, rescue breaths, and the use of the AED. What does the AED stand for? You see it wrong? It's on your paper. I help you out. This is why we do this.
Automated external defibrillation.
Very good. So can you use an AED if someone has an implanted device?
Yes.
Yes, you can.
Just don't put it on.
Just don't put it on top of it. Can you use an AED if the mom's pregnant, the mom's in
Yes.
cardiac arrest? Yes, you can. What if the person was a drowning victim? How much of their body do you have to dry? Just the chest area, the part where you're going to be putting the pads at. ROSC is a term your students won't be familiar with. So this is what I do. I'm treating you right now as if you're not instructor candidates or instructors. I'm treating you as if you're students. The American Heart videos will say terms like ROSC. Tracy, what does ROSC stand for?
Return of spontaneous circulation.
And you have to
The
simplify
pulse
it.
return.
Yes, we have to keep it simple. So what American Heart says, I need you to kind of change those terms around so that your students understand. Darren, minimizing interruptions. How long can we take our hands off the chest?
10 seconds.
10 seconds max. So second follow-up question to that, Darren. If the victim who's in cardiac arrest vomits and you're by yourself, what do?
Continued compressions.
Continue compressions. You can turn their head.
On the side.
You can't turn them on their side
So put
because
it head.
the head only, because you can't take your hands off the chest for longer than 10 seconds. So to turn them to their side and try to clear out their airway,
It's too long.
too long. And it also means that you switched your priorities. Your priority is no longer ABC. Verona at the very top of your paper. CAB stands for what?
Circulation, breathing, and air.
Gotta say it in the right order. CAB.
Circulation, airway, and breathing.
Circulation, airway, and breathing is the new priority. If someone's in cardiac arrest, we focus on circulation. You don't have to give a breath in the immediate moments of a cardiac arrest. You just keep doing circulation, keep doing your compressions. And then when the paramedics, EMS arrive, if you don't have a facial mask or something that's going to prevent you from putting your mouth on a patient's mouth, you don't even focus on the airway until someone arrives with the first aid kit, etc. If you put your mouth on a patient's mouth or on someone's mouth who's in cardiac arrest, what could you contract? Hepatitis, something worse. We just went through a whole pandemic. COVID. So now we get COVID. It's like, oh, I'm going to be home for a few days. I'll be fine. But if you have a weakened immune system, that could be a hospitalization and a lot of other things. So I need you to consider that when you're out there teaching others. Yes, you can use barrier devices, but right now there's no barrier device with a filter that's thick enough to prevent the passing of COVID. So if it's a family member or friend, you can teach them mouth to mouth, which the videos will cover, but they're not supposed to be putting their mouth on a stranger's mouth unless they're willing to risk, injury or hospitalization, disease, if you decide to do so.
I'll give you a story. Somebody got cut, and I didn't think, because all I wanted to do was stop that bleeding. So I put my hands and I said, what am I doing here? I went, washed my hands, grabbed a towel and asked him. I said, try to press on it. And he was conscious. I said, try to press on it. And so it happens, not even thinking.
So your BLS algorithm, especially during the pandemic, it prioritizes PPE. What is PPE?
Your personal,
We know that.
So PPE, as you said, personal protective equipment. So I know you want to rush in and help save this person, but you can't do so by endangering yourself. So for class, we do scene safety. We're like, hey, are you okay? But if someone's bleeding and they're in cardiac arrest, I'm sorry, you have to take a few seconds to glove up. You just can't go and render aid because now you have to worry about prophylaxis. You're getting tested for HIV, hepatitis, and so you always want to put yourself first. So safety first. All right, so we talked about what to do if someone's in cardiac arrest and they vomit, and you're by yourself. You turn their head within 10 seconds. You can sweep out their mouth, but you go right back to chest compressions. Do not take your hands off the chest for longer than 10 seconds because when you do so, you stop circulating the blood to the brain. How deeply do we compress for an adult? How many inches?
5 centimeters.
5 centimeters or 2 inches. What if it's a bariatric patient? You have a patient whose side view of their chest is this big. They're obese. Do you still compress just 2 inches or 5 centimeters?
It's deeper.
It's a fraction. What's the fraction? It's on your paper. See, I help you out. That's what this review is for. Your team members are giving you the answer.
2.4?
1/3. You see it on there? Look for compression depth. Your pen's moving really fast. Compression depth. It should say 1/3 for all ages. So we talk about the inches, we talk about the centimeters, but that 1/3 is truly important when you get somebody who's a lot larger. Next one is going to be for you. If we are stopping to give breaths, and it's just and it's an adult, what is the compression to breath ratio?
30 to 2.
For how many cycles?
At least
If you have help there, how often would you switch off?
whatever is needed.
Every 2
I was at
minutes.
5.
5 cycles or 2 minutes.
Okay.
And now if you don't have help, you keep going until you're exhausted.
Okay.
How long do you all think it takes the paramedics to come with current time frames?
10 minutes.
So we're approaching 10 minutes, usually about 7 minutes. So what we used to teach people were, you can do CPR about 3-4 minutes. The paramedics are going to be there. No, it doesn't happen like that anymore. So they really need
No
to.
offense.
Things have changed. We don't have enough caregivers. We don't have enough paramedics, etc. And then if the one that's nearest you, if they're called to, if they're already out on call, that means we have to call the second truck from a different area to come. So it could take a few minutes. So prepare your students because they may have to perform CPR more than 2 minutes. And you're going to see students after 2 minutes of CPR, they're like exhausted. It's like, well, hopefully adrenaline's going to kick in because we need for them in reality to do more than 2 minutes of CPR. Darren, the next question is yours. If we're not stopping to give breaths, what is the number of compressions we give per minute? Per minute. 100 to 120. If you go faster than 120 compressions per minute, our mannequins are going to flash. So your American Heart Association mannequins have to have 2 feedback devices. Do you know what those devices are? What do they monitor?
Heart rhythm.
Depth and
speed.
Yeah, so depth and rate. So depth, whenever we compress down, you're going to hear a click if you go at least 5 centimeters or 2 inches. The rate, when you go at the appropriate rate, you'll get 2 green lights. But what happens is when you go faster than 120 compressions per minute, you're going to get a 3rd light. That's telling you to slow down because you are not allowing chest recoil. What does that mean, to allow chest recoil?
It's not coming back up enough.
The heart's not refilling.
The heart's not refilling. So what you're externally, you're not letting it come back up, but internally, you're not giving the heart enough space to refill with blood because you're always keeping pressure on the chest. So that's the purpose of allowing chest recoil. So when your students are compressing fast, they're thinking they're doing a really good job. They're like, no, they just slow it down a little bit because you're not allowing the heart time to refill with blood. And we'll get to children and infants next. But now we have to actually practice our skills. So everybody, yep, you can move your items over. For classroom purposes, we do use our tables. So move your items towards you. Of course, in the real world, you would be on the floor if you're not in a hospital. Our hospitals have CPR modes on the beds. I'll give you a sanitizer. You're welcome. Go ahead and open up your pocket mask. Open up the one-way valves. And the pocket mask, you can insert the one-way valves into your pocket mask. Thank you. You're welcome. And you got it. And here we go. And so if you all would please place your pocket mask down on the side of your victim and you can stand. Go ahead and stand for me.
Oh.
No problem. All right, and so get the chair a little bit back. We have enough room. All right, and so the first thing we want to do is scene safety. I need you to look left and right. Make sure your scene is safe. All right, so the scene is safe. Now you can approach. You're going to hit your mannequin's shoulders and say, hey, are you okay?
Are you okay?
No response. Look at me and say, hey, you call 911 and come back.
You
Now,
call
call
911 and bring the
Perfect.
aid.
If you're in the hospital, of course, you would just press the code button. But here, we're not in a hospital setting. Now, 911 is going to be asking what's the emergency. You should already be doing these assessments. Where is the carotid pulse located? Carotid pulse. Good, good, good. And you want to look for breathing simultaneously for no more than 10 seconds.
There's no breathing.
All right, so it's right here. Don't switch your, oh, give me your left hand, please. I'm gonna move your chair over. It's a little easier with your left hand. You're fine, I see you.
You want to be on the same side of the neck.
And then go down a little bit. You may have to bend your, bend, so look at me, bend your finger. There we go, perfect. And now look for the chest, 10, 9, 8, and at the same time, 7, 6, 5, 4, 3, 2, and 1. There's no breathing, there's no pulse. Only one person, and no arms, and no legs. You're working one of those special MIC units. MICU units. Yes. And so there are going to be times where your patients, they may have had a hemipelvicotomy, or whatever the term is, so it's only like half a person. We still got to save them.
Yeah.
All right, so
There's no pulse.
there's no pulse, there's no breathing. What device do you call for?
AED.
The AED. I am the person running to go get the AED. And your company has their first aid kit down the east wing, the AED down the west wing. it's gonna take me like 2 minutes to come and bring those items to you. So my recommendation is always to get those items closer. So when you go into different corporations, you always wanna look at their equipment, open up their first aid kits, and when you find out the location of things, that's when you can recommend to them to bring it closer. One of the last companies I went to, their AED was still in the box. They hadn't sent in a warranty, they hadn't done like the medical director. They're waiting for me. I have no problem with that, but I would hope that you spent $2,000 on a device that person would have provided you with some type of information to get you ready. So when you go into these different offices, you're going to be the person that they're trusting because someone just literally sold them an AED and now you have to kind of give them guidance. All right, so help is en route. I'm coming with the AED and the first aid kit, but it's going to take me 2 minutes to come back with those items. Hand placement. If you're going to interlock your hands, put it in the center of the chest. Chest is exposed. Awesome. Good. And then just press straight down. Perfect. Let's see you, Verona. All right, gotta press down for me. All right, so with our mannequins, whenever you press deeply enough, you're going to hear a click. So I'm going to put my hand on top of yours. Go ahead, put your hands back in spot, and I'm going to press down. So that's 2 inches. And if you have to go to the floor, we can put you to the floor because we start off on the table. But the goal, when you all see that red light, that red light means that we're compressing too slowly. So after 30 compressions, I will teach you all. Miss Rona, you know who All right. So after 30 compressions, let's go ahead and simulate our 2 breaths. You can go ahead and put your pocket mask on, ankle part at the bridge of the nose. All right, and so you're going to press it tight, and so it's going to be, watch my hands, so yeah. You see? You don't have to do that with this one. It's just press, and tilt. All right, bend down, give a breath, watch your chest rise. Do you see chest rise? Sorry, I can't look at it. I see yours, Tracy. Let me see yours over here. Good, and now you gave your 2 breaths?
Yeah.
Okay, now put your mask down, and now let's do it for real. 30 compressions, let's go, count for me. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, perfect. 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29. You have 10 seconds to give 2 breaths. Put the mask on. 9, 8, 7, open up the airway for on 6, 5, 4, 3, 2, and 1. Max down, Verona. Compress again. Let's go. I need to hear you all. 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 2 breaths. You have 10 seconds. 8, 7, 6, 5, 4, 3, 2, hands back on the chest, go. 9, 10, great compressions, everybody. 14, 15, 16, 17, 18, 19. We only have 2 more cycles. 24, 25, 26, 27, 28, 29, 30. All right, 2 more cycles. Team, go together. Let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 2 breaths. Oh, it was taking me a long time to go get that first aid kit. Last cycle, let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29. Last 2 breaths, team. I'm so proud of you all, and great job. Whew. How do you feel? For classroom purposes, you can have a seat. All right. Great job, team.
Save my baby's life.
You save these lives, yes. So question, Tracy, why are women, if they go into sudden cardiac arrest outside of a hospital, why are they more likely to die? than men.
Because people don't want to touch their breasts.
They don't want to touch the
Let
breast.
alone expose them.
So how are you addressing that during the classes when you teach?
I tell them.
Okay.
I tell them that they're not going to care about that. They're going to care about being alive.
Amen. All right. So let's not delay chest compressions because we don't want to touch chest. And if they have to, if they are just adamant about not exposing the chest, they can start their chest compressions on top of clothing.
Onto.
And then whenever another rescuer arrives who feels comfortable exposing the chest,
Okay.
that's when they can expose it in preparation for the AED.
Okay.
But by them not exposing the chest, they're delaying the use of the AED.
Okay.
Okay. What questions do you all have about the first part of our skills? That was just chest compressions. Something that I like to talk about, because as BLS instructors you can teach it, is Narcan. Do you all know what Narcan is used for? Naloxone, drug overdose. Is it possible for marijuana to be mixed with an opioid?
Yeah.
Yes, and these kids are now doing pill parties where they're pouring everything into a bowl and they're just popping to get whatever high, low blood pressure. They're just doing things now. Everyone's trying to find the ultimate high. But in finding the ultimate high, that means that even things that if nature made it, unless they're buying it directly from a dispensary, it's more than likely laced with something. And so it could be laced with fentanyl. What was the other one? The one starts with a methadone. There's so many different drugs. Heroin, that's what I was trying to think of. And so you want to make sure that you know how to use Narcan intranasally. You cannot use Narcan if the person's in cardiac arrest. The Narcan will hopefully prevent the cardiac arrest. So you come up to a victim and when you tap and shout, they're still breathing, they still have a pulse, but they're not. They could have a gurgling or a wet sound, and that's because either they vomited on their saliva, they've already vomited because of course the toxins have made them vomit and they couldn't clear their airway, or they can't swallow their saliva. Tilt their head back. Open up the airway, insert the intranasal device. You don't necessarily have to squeeze one nostril, but if you want to, you can. And then you press on the plunger to give them their Narcan. So we're going to open up the airway, insert, press on the plunger. And when I give you your Narcan kits, it has two dosages in it. And we rather you use it even if the person isn't on an opioid, because if they are not on something that caused their respirations to decrease because of drug use, it will not hurt them. It will not hurt them. Narcan binds up opioids. It binds it up at the brain level, at the cellular level. And so it's competing, and that's helps to reverse the medication. It helps them to start breathing again. You're also going to be stimulating them, because when you did the whole hey, are you okay? They didn't respond. So now it's like stomach rubs. I've seen them. I can't tell you to slap people. I'm just saying, not with the cameras on. But you want to start stimulating them, because hopefully it's going to make them take that deep breath in. So now they have the Narcan in their system. How do they wake up? Do they wake up nice and friendly?
Usually fighting.
Yeah, they're confused. So you have to be ready to protect yourself. So yes, you're trying to save this person's life, but at the same time, you have to protect yours. And you should just start talking to them. They'll eventually calm down. But you gotta think about it. They were so sedated, so heavily medicated until they were in an unconscious state, and now they're up and they're awake. They don't know where they are, and they don't know who you are.
And they're pissed off you took their high.
And they could be very upset that you took their high. That is so true. So usually if you give one, you have to call 911, because number one, you're going to need help. And then sometimes it takes more than just 2 dosages. Maybe they have some type of obstruction. Whenever the paramedics get there, they will be giving intravenous Narcan. Can you give Narcan intranasally to someone who's in cardiac arrest? Can you give it to someone who's dead?
No.
No, because in order for you to give this one, the person must be doing what?
Inhaling.
They have to be able to breathe.
Actually, that works on the blood-brain barrier.
Yes. So they got to be able to breathe. If they're not breathing, you can't use this one. Okay. Now, next question. Once you have your Narcan, can you keep it in your car? Should you? No.
Can't be hot.
Can't be hot, can't be cold. So you can keep it in your bag. talk with your companies, because I'm giving this to you for personal use. Like, I keep a first aid kit in my car,
Yeah.
and I have Narcan I have it here in the office. I usually take it outside the office, but we have so many people who come in, and we also have, you can tell we have a larger unsheltered population now, and sometimes they come in here just to cool off during the day, and we get all types. So my Narcan is usually for the office more so than when I'm out in the public. You have anything you want to add, Darren, about Narcan?
No, it can be, it's not gonna hurt them using it. That's the big thing to get across, is you're not gonna hurt them by using it. So you're better off to give it a shot, and hopefully that fixes the problem.
Yeah, because sometimes unless the evidence there or you won't know.
You're not necessarily gonna find a needle there or anything like that. They could pop pills and
We've
stuff.
seen very random people at work fail drug tests that you would not think.
Mhm.
So you won't necessarily always know.
And it doesn't work on everything.
I have a student who is from the Ritzier area, and he told me, he said, oh, we don't have those issues in my area. And this was right after the shootings at Jack's Beach. I forgot what the holiday was or whatever. There was a lot, it must have been like spring break or something. And the kids were there just taking stuff, and so they were just vaping, not knowing that what they were vaping was laced. So you can't assume that it's not in my neighborhood, because these kids are smoking, they're using drugs. It may not be in your neighborhood, but when your kids leave your neighborhood, I need you to know how to use it. So now we've given it, the person's starting to breathe more. What position do we put them in?
Recovery.
Recovery, which means you put them how? On their
Left
side preferred, but definitely put them on their side.
Knees out.
Knees out, you
arms
got it,
out.
yep, support that head. Why? In case they vomit, okay? And so now we'll talk about the AED. So at the very end, I have the Narcan looking at me. I don't want to bring it out now, but I'll make sure you have your Narcan kits before you leave today. The bottom of the containers show the expiration date of the actual medication. The very top has a green label. We've partnered with the Clay County Fire Department, and that's how we get our Narcan sources, through their grant. If you use the Narcan, they want you to let them know that you've used it, and if your Narcan expires, or if you need more, you would just look at the green label on top and get you some more. Okay? Unfortunately, the drug dealers in our area are super smart. In addition to selling you the drugs, they also sell you the Narcan. What? So yes, Darren, if I can get you and Tracy down here. All right, and if you'll turn your mannequin's head toward, perfect, you're fine, I'll leave it over here. All right. And then you and I will be here. Yes, ma'am. If you'll bring your mannequin this way. The first thing we have to do, everybody, is we have to practice with the bag mask device. And I'm going to bring another bag mask device for you, Verona. Darren and Tracy, let me know if you have any problems down there using the bag mask device. So you'll be watching him. This is the EC clamp technique. Good.
Every 30 compressions you want to do it.
EC clamp technique. Okay, make a small C with your hands. That usually works better. Small C, baby C. Baby C, you get better control. Open up the airway. Use your body if you need to. Okay, and now give a breath. Where do you feel air escaping? Your C is no longer a C. There we go. That's a C.
Respiratory arrest for drugs.
Okay, just half
That's
squeeze.
when you're just gonna breathe for
Good
and have a
and
good
good.
pulse, but they're not breathing.
Try it again. Don't break your seal. Good and
It's recovering.
good. Very good. Did you practice it? All right, let's see you practice it.
And you turn to the jaw.
Thank you, Darren. And don't be afraid to use your body.
Slide up right up against you.
And just half squeeze. Half squeeze.
Yeah.
Don't want
Only
to
enough to get
vomit.
enough resistance.
Too much. Half squeeze. Half.
When the chest goes up, that's it. You don't want, you don't need to pull back. Pull back is gonna force it into the stomach.
And so what happens is,
throw up.
Yes.
so as soon as you see chest rise, stop squeezing. So stop. Stop.
Perfect.
All right, so now everybody,
Easy squeeze.
so you can tell here, it's not on the nose, so pick it up, reposition. Don't try to have this towards you. Mask position first. 2 fingers on the mask, 3 fingers on the chin. So this is the C and this is the E. Open up. Where do you feel air escaping? Okay, good. Open up.
Bigger person.
I saw it.
Barrel chest.
You're letting it.
So basically all it
So
is,
watch me.
You're just putting enough.
Watch me. Watch me. You can't watch me if you're trying to do it. So I'm going to take this totally off. I'm going to position myself. I have this resident towards my left leg. So the resident is on the bed or he's on the floor. I'm going to move my body because I need my body to help keep this airway open. I have my leg against his head. We're not worried about infection control right now, okay? And so I'm going to open up the airway. C, E, and give your breaths. And give your breaths. And don't break your seal. And don't let the airway down. Because every 16 seconds, you're going to be given 2 breaths. So once you have this airway open, you keep it open. Let's go ahead and practice. Don't let the airway down. Baby C. Is the mask over his eyes? Because the mask doesn't appear to be right. Good job. Very good. All right, so let me just move this cup of coffee. And now, team, we're going to go into our 2 rescuer scenario, and then we'll talk about the use of the AED. Once the American Heart Association's basic life support video is going, this part will be during child BLS or child CPR. Whenever you have 2 or more rescuers with a child, what's our new ratio?
15.
Why? What are we giving more of?
Air.
Oxygen. So if you'll go ahead, and when we get to our 15 compression, Tracy, when we get to 15, we hover our hands so that our person who's delivering the breaths can see the chest rise. So let's say this is my 15th compression. I raise, and then she give her 2 breaths. And remember, if you let the airway drop, don't let the airway drop, because 15 and 2, that means like every 8 seconds.
That's not long.
So we can't keep closing this child's airway, okay? So make sure you're in position. So you keep bringing this up. Stop trying to bring it up to you. Keep it firm on the space, okay? Let's go, Tracy. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Good job. Let's do it again. Good. Keep it there. Let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Give a breath. Let's see you. All right, so let's switch. We have 10 seconds. 9, 8, 7, 6. Compressor. Start compressing. Let's go. Rest deep. Good job. And hover, hover. 1 and 2, and you have to count. Let's go. 1, 2. Good job. Perfect. You can have a seat. Great job. All right, great job, you all. And so whenever you're trying to give a breath,
I
think it's too far up.
There you go.
I think it's on his eye. And I can see like I got right here. So press it down.
There you go.
You got it. All right. So great job, team. So you can, if you have a back mask device, you can utilize it. This is what the professional rescuers are bringing. More than likely, you'll see something like this in the first aid kit. But remember, this doesn't provide protection against COVID.
None of it does, really, does it?
They filter. So for like COVID, usually like on a special people filter. And so let's think about the type of filter that's in your air conditioning. So in the facilities, whenever, like now people have kind of like minimized the potential of COVID being spread because they feel we have mass immunity now. But if you have a weakened immune system, I'm just worried about those who may not have such strong immune systems to where if you give a breath to somebody and you contract something, it's going to be detrimental to you. Mm-hmm. So you can just do a high quality CPR until your team members arrive with the bag, because that makes sure that no one has to put their mouth against a resident's mouth.
Okay.
Or then what if it's vice versa? What if it's your resident or your patient who has cancer, who's on chemotherapy, and you decide to go give mouth to mouth to them, and you're the germy one? Because healthcare providers are germy. It's just that when we're strong, when we're healthy, you don't know how many illnesses we have until we get older, and that's when, oh yeah, now you have, what's the one that makes you scratch? The blisters, they have the
Shingles.
shingle. Yeah, that's when everything starts manifesting.
Yeah.
All right, when the AED arrives to the scene, what's the first thing you do?
Turn it on.
Turn it on. Instructors, whenever I'm teaching initially, because the video does a lot of teaching, so the video is already played. And then when the video pauses, I just go through and do just a recap to make sure the students understand it and give them time to practice. It's going to be hard for them to hear you and hear the AED. So initially you're talking. The second time you let them do it, and that way they can listen to the device. So once I power this on by pressing the green button, it's going to tell me to apply the pads. And that's why it's important for you to know how to use the AED at your workplaces, because for some of them, the AED pads are already attached. So this one's going to say, apply the pads. There's the illustration on the actual pads. Make sure your students see them. You're going to have them peel and stick. Peel and stick. What do you do if the person has a nipple ring?
Leave it alone.
Leave it alone, but
Let
don't
it
let the
dry.
pad touch the ring. Underwire bras, what do we have to do? Remove the bra. It has to be cut, and most of your AED kits have scissors that can cut through. After the pads are in place, it's going to say connected, and this will start flashing. This is where we connect the plugs. Now this is saying analyzing. If someone is touching when it's analyzing, it's going to pick up their heart rate. So that's why we say what one word?
Clear.
Clear. Everybody clear. For you, if they don't know what clear means, it's like, get away, move back, okay? So for your team members, because they're going to be mostly non-medical, I would probably recommend using the AED exactly as it states. You're not going to go back in there and do compressions in the middle. But for basic life support, as you're teaching your nurses and your doctors, when it says charging or shock advised, we go back and we do more compressions.
Ours says that.
Okay, very good, very good.
After it was the ticker.
And what's the ticker called? It has a name. The metronome. Instructors, you have to know that. Go ahead and metronome. Get your papers, because she said the ticker.
Okay.
Here's your pen here. So metronome, N-O-M-E. And the metronome helps you keep your pace with the compression. So it's a beep, it's a tone. All right, so after we've cleared everybody again, we're going to press the shock button and we go right back into our compressions. And Darren, can I get you to come over here, sir? Right now, we're not worried about giving a breath. We're just worried about chest compressions and the defibrillator. Because if we only have 2 people, that's going to be our priority right now anyway. For classroom purposes, we're on the same side. We're here. That way he has more room. He has like the whole legs over there. Can you see okay?
Mm-hmm.
All right. And Darren will clear me. You can just press it. 4, 6, 7, 8, 9, 10, 11, 12.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light.
27, 28, 29, 30. 1 and 2.
Apply analyzing heart rhythm. Do not touch the patient. Shock advised.
Tell me to compress.
Compressed.
Charging.
Move back. 1, 2, 3.
Stay clear of patient.
7, 8, 9, 10.
Deliver shock now. Press the orange button. Shock delivered.
Nope, up high.
Begin CPR.
Faster. Too fast, slow down.
You want me to compress to what?
30 compressions to the next one.
Very good elbow, sir. Great job. Would you please say that for classroom purposes only, we're turning off the
Classroom
AED?
purposes only, we turn off the AED.
Perfect. When would you turn your AED off in the real world?
We won't.
We won't.
We'll let paramedics take it off.
Very good. Proud of you, sir. All right. You sure you don't want to come back and teach classes to the public? I keep trying. I won't erase his name off the board for a reason.
You never know what the future holds.
Do you ladies want to come over and practice this one? I know you have your facility. Ramona, do you want to practice next?
Sure.
Okay, thank you so much.
Are
And
you gonna do the compressions?
yes, please, thank you so much.
So are we doing team safety and everything? Or we
No, just, I know in the real world you would.
Here.
So AED's here, you can start your compressions. This is the third street. One power on first. 7, 8, 9, go ahead and walk around her.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light. Apply pads. Plug in connector.
2.
Analyzing heart rhythm.
You have to say it clear.
Do not touch the
And
patient.
you all get into the habit of talking louder. These are some noisy situations.
Shock advised.
Say compress.
Compress, please.
1, 2,
Charging.
4, 5, 6,
Stay clear of patient.
11, 12.
Deliver shock
You
now.
have to say it
Press
loud.
the
You
orange
can't wave your
button
hand.
now.
Say clear.
Clear.
Shock delivered.
Don't do
Compress,
it. Okay,
please.
very good.
Begin CPR.
1, 2, 3, 4. Very good. You all can stop. Very good. Verona, you have to speak louder, baby.
You got the bosses around. These are lockers. It'll be like,
I know, they can't hear you. Machinery going and she's like, clear. So Verona, let me hear you say clear really loud. Clear, that's right. As a matter of fact, you gotta say clear and make eye contact.
Clear.
Now I'm going.
she got it.
She got it now.
This is deep down in there.
She gotta pull it for us. When she gets through teaching again with these young people who don't
You need
listen
some
too
kids.
well.
I got 4. You want some? You need some kids? I got 4.
Oh,
I'll take care of that, Verona. Verona's going on her cruises. She is not worried about kids right now. What questions do you all have? We just covered adult and child CPR. Any questions? So the AED, the same placement that we use for an adult, would be the same placement for a child. High right, low left, or either some off to the side, but follow the pad instructions. If something's preventing you from putting a pad where the picture says it should go, let's say somebody had an implant device like their chemotherapy port on the right upper chest. That's not your role. You cannot make medical decisions like that. Who's on the phone with you? Not the doctor. No. 911.
okay.
So you would probably just keep doing chest compressions until the paramedics arrive, because they have a medical doctor. They have someone they can call. But believe me, they already have policies in place to where if you can't put your AED here and here, they already have other policies that they can use. I just can't have you making your own policies. That means that you're now stepping outside of your scope of practice.
Yeah, because you can never really go the opposite way, right?
No.
So for you, for liability, it's always following the pad packaging. And whenever you step outside of that, just think about lawsuits, because you didn't do what that machine
Told
said.
you to do.
And the people who can do things differently are the ones you call. And so they can give you different instructions, but you just can't make them up on your own.
What if you're alone and you call and they tell you where to put it? Nobody else heard.
They're gonna tell you to
It's
follow
recorded
directions.
line.
They're gonna tell you to follow directions on the pads.
Yeah, follow directions, because we don't want you stepping outside of your scope of practice. We don't want you trying to be the medical doctors on the scene.
Those old pads are so weird.
The big ones.
But if they're effective. So let's talk about those really big pads. Because if all you have is an adult AED, but it's a really small child or an infant, we can still use that AED in those big pads. But you were just talking about the placement. Where would we place them? They can't go in the normal spots.
On a chest.
Front and back. So this child is going to end up with a burn. This infant's going to end up with a burn, because we're using an adult dose of energy on a child or energy. But if the baby lives, mom can do a skin graft, we can get some donor skin, they can heal and they can live with burned skin. So I need you.
can use an adult pad.
You certainly
That's what I
can.
teach. Okay.
You certainly can. choking, before we go to infants, which will be our last skill that we have to do, everybody on your body, show me how to help a choking person. So if a person's choking, what do you do behind them? Good, 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 good. And so the reason why I have everybody do this in my classes is because with the video, when it plays, and I can't show the video because American Heart Association got on me about showing their videos in my videos. So I make my own videos without showing their videos. That's how we do that. Is that your students don't know where their hands should be placed. A lot of them end up hugging themselves. So the video just showed it, and now I pause the video and I say, okay, demonstrate it. Show me on your own bodies where you place your hands, and they don't do it correctly. Their hands are too close to their breast. And if they're up there, what bone is at the end of the breastbone? Xiphoid process. I keep images up in my office for reasons. This is the xiphoid process, very pointy bone that sits above the liver. So that bone is going to lacerate the liver. The liver is a bloody organ. So yes, they're going to be helping the person who's choking, but they just cause internal bleeding. So hand placement, locate the belly button, poke, feel it. Thumb above the belly button, cup, and you go up. You get too close to the breast, you're not in the correct spot. What do you do if the person's pregnant or larger than you? Where do your hands go?
Up higher.
Up higher, center the chest.
And then
Center,
right.
center chest. Let me see you do it.
Oh.
And then you go straight
Straight up.
in, not up, in. And it hurts. I had a student, we were just joking around at a high school. Hey, show me what to do if I'm pregnant. And the student did it, which is why we don't let them practice this on each other, because they could hurt each other. And I had a bruise by taking one for the team, so. All right, so let me pass around the babies. Any questions on the golden child CPR? All right, so first we want to actually help the choking baby. So, choking baby, I just passed you my baby, baby's choking. What do? Tracy's giving me those blank stare right now. What do we do?
Because I'm thinking for us.
Yes.
I don't do the infant a lot. Then you know the infant lockers.
Alright, so just be careful because you want to support the baby. So turn your chair, turn your body. Alright, and so on your leg, and then you can do a little more gentler. 1, 2, 3, 4, 5. And now this hand supports the back of the baby's head, and you can rotate to the other leg if you had enough room. And the head should always be lower than a diaper for what reason?
In case it comes.
Gravity, yes. 3, 4, 5, and I saw you there, you're good. And so instead of holding here, remember babies have this bobblehead syndrome, so don't put your hands around their neck. You need something kind of supporting your chin. Now let's go again, last time. 1, 2, 3, 4, 5, support and flip. Let's go, chest. 1, 2, 3, 4, 5. You know you don't have to hold that baby in the air, right?
Put it on my leg.
Put it on your leg.
Let me like, oh!
But you use your other leg. You got two.
You get tired really quick.
And it gives you extra support. Good job. All right, so everybody, your baby vomited. Your baby just vomited. Darren, your baby vomited. Hold your baby upright. Look in the baby's mouth. Show me which finger you're going to use to remove the object.
Pinky?
Yeah, because she using her index finger saying pinky, but you're not going straight down.
Swoop.
Sweep. Sorry, your baby swallowed 2 objects. You only got out 1. Please place your baby on the flat surface because your baby stopped moving. Place your baby on the flat surface. Your baby stopped moving. Oh. All right, power your baby on. You all are not going away from me at all. I love it. You're saving the baby's life. All right, so let's go 30 compressions. Got to count because if you go too fast, Roland. 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29. I'm going to pause you. They do have pediatric masks, but you don't happen to have one with you right now. So what you do instead is you can still give the baby a breath and you're just going to simulate. You're really not going to do it. Where would you put your mouth in relation to the baby's face?
Nose and mouth.
Nose and mouth. So after you give your 30 compressions, you would put your mouth over their nose and mouth and give 2 baby breaths. You don't have to squeeze the nostrils. You can't squeeze their nostrils, Miss Verona. 1 and 2. No, don't. For classroom purposes, don't.
Okay.
But in the real world, yes, you could.
Okay.
All right, so now let's go back to that 30 compressions. Let's go. Right airway.
2.
Good job. And now pause. Now we have a helper that has arrived. What you'll do now is your 2 thumb encircling hand technique. So you'll wrap your hands around your baby like so. So you'll stay right where you were. Good, good, good. Good, good, and let's go. And if it's 2 rescuers, what's the new count? 13, 14, 15. Thumbs up. Great job. And rescuer number 2 will be giving those 2 breaths. All right, so let me give you all a pocket, a bag mask device. Just bear with me. If you'll get back into your previous team arrangements. So you and Darren will be together on the other end down there. And Marona, you and I are together down here.
Oh.
When, so this is now, here, so Marona. There we go. Okay. All right, so mask on. 15 to 2, let's go. So anytime it's 2 people, it's always like this.
Oh, this was the second. 8, 9, 10, 12, 13.
Great job. Thumbs up so I can see. Thumbs up. 1 and 2. Let's go. Great job. 1 and 2. And for this one, let's trade the spots. I'm just going to turn him. I'm just going to turn him so that you don't have to look too much. Good enough. Let's go. 2, 3, 4, 5. What his 3 fingers should be. 3 fingers should be there. So E, C, open. Open the chin. 3 fingers. Why are you not using your 3 fingers? 1, 2, 3, 4, 5, 6, 7. Close the baby scareway. Keep it open.
Just enough.
All right, good job. We can stop. All right, everybody. That was our morning review. That was the first hour of our class. What questions do you all have? And Verona, I know you wanted your equipment list. Verona was trying to get everything ready before she came, and I was just trying to slow you down because I'm like, how are you going to travel with mannequins? So what I highly recommend is that you keep a lot of rechargeable batteries because the batteries in these, they go out fast. So, and now you'll receive your equipment list. It'll be emailed to you, if not tonight, tomorrow.
Okay.
Any questions you all have before we take our first breaks? Great job, Lifesavers. When we come back, it's video and exam. Woo-hoo!